Japan is set to declare a state of emergency as early as tomorrow over the COVID-19 pandemic. Prime Minister Shinzo Abe says the emergency will last about a month and will apply to 7 hard-hit prefectures, including Tokyo and Osaka. This will be the first time such a declaration is issued in Japan. The move comes as the rising number of infections puts a strain on the country's medical system. Across Japan, more than 3,500 people have caught the virus. A quarter are in Tokyo, which reported 83 new cases today. Health authorities have warned that Japan's healthcare system may collapse if infections continue to spike. Michio Yoshida joins us for the latest from Tokyo. Michio, what took Japan so long to declare an emergency now?
Well, what analysts think is that probably Prime Minister Abe was worried about the impact on the Japanese economy. Some economists have been forecasting a 10 to 20% contraction of the second quarter GDP of the Japanese economy if there's a lockdown. But Mr. Abe has been under pressure from the Japan Medical Association, an association of doctors nationwide, from governors of Tokyo and Osaka to declare a state of emergency. And a recent poll conducted by TBS, Tokyo Television Broadcasting Network, saying that 80% of the Japanese public support state of emergency declaration. So Mr. Abe seems to have decided to designate 7 prefectures, that is Tokyo, Osaka, Saitama, Kanagawa, Chiba, Fukuoka, and Hyogo prefectures.
Mitch, how will a state of emergency affect people in these 7 prefectures, in these targeted regions? How is it different from a lockdown?
Well, Mr. Abe has basically been saying that people should avoid where there's poor ventilation, where there's a crowd, or contact directly with somebody nearby. So that's basically what he's been stating. Otherwise, he's been telling people to stay calm because railway lines will be running. There'll be shops or grocery shopping will be available, and utilities will be looked after. People in Tokyo have actually been experiencing something similar the past 2 weekends. Department stores have been closed except for the grocery area. Small shops have basically been closed. There's no Disneyland, there's no Disney Sea. So that's been the case here in Tokyo so far. And it seems like it's been working because a lot of people were not out and about in Shibuya and Shinjuku. You know, the Yamanote line, which circles around central Tokyo. I could easily get a seat from Shibuya to Shinjuku, and this is really unusual. So it seems like Mr. Abe wants to do something similar for the coming next month in other major cities throughout Japan where there's been a rising case of COVID-19. And it's to be seen if this is going to work, you know, without having to go through the extreme of announcing a lockdown.
Michio, one last question for you. U.S. forces in Japan also declared a health emergency. What does this entail?
Yes, well, it's in the Kanto region, where surrounding prefectures of Tokyo are included. According to the U.S. Forces Japan statement, the declaration ensures commanders possess the necessary authorities to enforce compliance, health protection measures among military, civilian, and contractors who live and work on U.S. installation. And it's expected to be in effect until at least May 5th. Now, Yokota Air Base in Tokyo, it's home to USFJ and the 5th Air Force, and Camp Zama in Kanagawa is home to the U.S. Army Japan, and Yokosuka Naval Base is strategically important U.S. naval base for the region with the 7th Fleet. So this is the measure expected to be taken.
Okay, May, thanks for that update. Michio Yoshida speaking to us from Tokyo.